Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
The purpose of this podcast is to educate and inform. This is not a substitute for medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.
Hello, and welcome to ASCO Education's podcast episode focused on the important and far-reaching effects of burnout among oncology trainees. My name is Dr. Anna Laucis, and I'm a radiation oncology resident physician at the University of Michigan.
And I'm Dr. Daniel Richardson. I'm an assistant professor in leukemia doc at the University of North Carolina. I recently completed my hematology-oncology fellowship here at UNC as well.
So, Dr. Richardson, what has been your personal experience with burnout and your medical training in your current professional role?
Well, that's a great question, and something that I'm excited to talk about today. So burnout can really be expressed and experienced in numerous ways. Traditionally, we've segmented this into categories of emotional exhaustion, cynicism, and feelings of inefficacy. And one of the first things to mention is really the structure of the practice of medicine itself. I really see in most places that medicine continues to be very hierarchical and rigid. And this hierarchy and rigidity can lead to depersonalization. I feel like we have a tremendous opportunity to connect with patients, and many times in their darkest days, but we're taught that we can't show vulnerability and we need to act in a certain way. We are conditioned really to place boundaries around ourselves, to depersonalize as a way to get through rounds, as a way to improve efficiency. I know you probably experienced this, but on the inpatient wards, on morning rounds, we go from room to room. We listen to patient stories about the devastation that cancer has caused on them, but we don't talk about it. And we don't allow empathy really to come with us into rounds, and we exclude emotions altogether. I think about, as a leukemia doc, the challenges when some of my patients die, and we don't talk about that. We don't talk about those challenges. We don't talk about our own emotions as we go through that process. And I often comment to others that I walk through kind of the valley of the shadow of death with most of my patients. And this human connection that we can have in the midst of that is so important. It's truly a sacred space where we can invite our patients into. And this process of walking, with patients through that can bring about great meaning and satisfaction.
Yeah, I fully agree that I think there, are many ways in which we connect with patients. And I think that's really important as oncologists, whether radiation oncologists or medical oncologists or surgical oncologists, just the ways in which we, connect and empathize with our patients. It's not only, I think, the greatest gift and support we can give to patients, but also, I think unfortunately can also, really lead to burnout. Especially it's difficult to set boundaries sometimes. We really invest in our patients and we kind of almost take personal responsibility for their outcomes as well, even though, as I've gotten further in my training, I've realized that, unfortunately there's just really bad, biology, sometimes just really bad disease. And as much as we do, there is a limit to what we do. And I think that as I've gone through my training, I've recognized that being able to set boundaries, however difficult that is, while still empathizing, having a way to find meaning and purpose outside of work is so important as well, and can kind of help reduce that burden of burnout. And kind of one of the ways I've conceptualized this is we kind of absorb these collective traumas, as you mentioned, kind of walking from room to room in the hospital ward. For us, it's in the clinic in radiation oncology, but kind of going from room to room, I kind of try and take a second, and whether it's washing my hands or kind of just taking a moment to kind of reframe it really helps to kind of set that boundary not only between the patients and ourselves, but also between patient to patient, because it is so important that we give as much as we can to our patients, but also that we find ways to kind of refurbish and kind of refill this bucket of energy and dedication that we have.
Yeah, I think your point about finding identity in your job, I think is it's both a double-edged sword. I'm a huge proponent of finding meaning in medicine and really finding ways for us as a community to find meaning in medicine. But also, if we find our whole identity in our work, it's really going to become an idol in our lives, and it's going to inevitably fail us. I think trying to use work alone to sustain our deep need and purpose as a human being is probably not enough. I find, that work has a place in my life and has a place as many times our calling. However, I don't think it can fill, every aspect of it. And if we try to put kind of that onto our work, even a tremendous calling such as oncology, it's inevitably going to fail us.
Absolutely, I agree, and I think one of the things that to keep in mind is that whether I think in medicine in general, but in particular oncology, it really stretches us to kind of our full capacity in training, and we kind of give it our everything. And I think sometimes, as I've kind of talked in conversations with other colleagues, sometimes we give it so much of our all that other kind of elements of ourselves that made us interesting and dynamic and multifaceted, in high school, college, medical school, cooking, exercise, kind of all of these things that we do to be a complete person. Some of that, does, I think, by nature of the intensity of our training, especially in oncology, does get pushed to the side. But I think it's important as much as we can to find ways, even if it's small, even if it's small amounts of exercise or small amounts of cooking or kind of joy in other aspects of our life, to reintroduce those when we're able to in training, because I do think it allows us to bring our full selves to work and to connect with patients in the best way we can as well. I think one of the things that I love the most is being able to bring a smile to a patient's face, even though they are in a very vulnerable time. All of our patients pretty much have cancer. But, like for example, the other day I connected with a patient about going to Harry Potter World and kind of Disney. And that really brought a smile to his face, even though, we were dealing with a metastatic cancer for him. But I think that really brings meaning and also is so important to do to be able to connect.
Yeah. So I want to jump off 2 points. So the first one, you said, how do we have these repeated traumas in our lives and how do we kind of manage those? I think, this repeated trauma or this repeated suffering that we experience on as part of our jobs really erodes our ability sometimes to engage into our own lives and engage in the lives of our patients. And, I think about as oncologists, we often are mediators of life-defining information. We often tell patients, that they have cancer, that they aren't going to survive the next couple of years, that they need to make decisions to prioritize as we move forward. We can feel like we are the mediators of devastation to our patients. And I think, as we mentioned, kind of one strategy is to build these deep, impenetrable boundaries where we don't allow that suffering to seep into our souls. Sometimes we talk about resilience. But I think that, as you mentioned, too often we can hide in our boundaries and not allow that connection to happen. And I think, as you mentioned, these small things that we can begin to do, we can begin to connect with patients to give them good. I really think that this is developing a strategy of redemption rather than resilience alone. That is, we can learn how to find great meaning, purpose, and satisfaction of walking through the suffering with our patients rather than simply learning to endure it as a side effect of our lives. And this really comes from embracing caring for the suffering as a calling and finding ways to bring good into the lives of patients, in the midst of their suffering. So you mentioned, kind of talking to them about Harry Potter, getting to know them, perhaps it is just this listening ear. I think oftentimes patients have a tremendous story to tell, and allowing them to tell it and walking them, through it is so important. Perhaps it's a prayer, perhaps it's a hug, perhaps it's just the acknowledgement of the loss that they're experiencing, kind of finding those, connections with patients and bringing good into their lives in the midst of the suffering that they're experiencing is so important.
Yeah, I fully agree with you. I think that's one of the greatest gifts, that we can give as physicians. And it reminds me of, so I did a lot of art history in high school, really enjoyed that, very different from medicine. But I think one of the interesting things, and I'd love to take like a specific course sometime on just the history of medicine through the lens of art. It just reminds me of this famous painting of the physician at the bedside of a patient, holding their hand. And, in those days, this was, way back, in the early times where medicine was really more about just the physician kind of, the word attending, comes from just attending to the patient's needs. And I think that sometimes we get so tied up in kind of, learning all the clinical trials or all of the oncology outcomes. But I think that at the core of it, and I know that the ACGME is an initiative, back to bedside and trying to find the joy in medicine, that I think there's a lot we can offer just as a fellow human, as a fellow kind of, person who brings, redemption, hope. I think it's important to draw the line there, especially in oncology, to not offer false hope, but I think to give as much support as we can to patients, because it is a very vulnerable time. And yeah, I think patients have very interesting stories, just getting to know them, even if it's, asking about their family or things that are important to them. Or I try and recognize if patients are wearing like a shirt with a logo on it, and I recognize that, I try and bring that up, and you'll often see their face light up. Like, a patient recently follows the Detroit Tigers. And so he was having horrible, nausea, but then talking about the Tigers, his face lit up and he kind of forgot about the nausea for a moment. And so even just those moments of peace that we can bring to patients, I think that for me at least helps, combat burnout, because I really find a lot of purpose and meaning in that. And I know that at least in that moment, I gave that patient some peace and some joy, perhaps.
Yeah, I think that's really important as we think about our role as co-journer, as kind of people stepping alongside and walking with patients through their journey with cancer. Obviously, we'll have opportunities to experience great joy for some patients and great sadness for others. So I think that is really an opportunity for us to enter into those experiences with our patients. I'm interested on your perspective on how COVID has really impacted your experience of burnout or other aspects of training for other residents.
Yeah, would love to touch on that. So I think that COVID's been very interesting from the standpoint of just completely turning on its head everything that we thought was important about I think medicine, kind of our experience, even the didactic structure. That was one of the early changes, that all of our didactics became virtual. In a sense that took away some pressure, where we rotate between multiple sites in our training program, and that was actually one of the stressors before COVID, was having to kind of drive, physically from one site to another, or even like in our research block, having to, for me, I live, 20 miles from my work. So having to drive that far distance. So, that was kind of a silver lining of having a little more flexibility there. On the other hand, I think that one of the challenges that's brought up, particularly in the context of burnout, is that I think one of the aspects of wellness and kind of a culture of support is truly those person to person interactions, especially amongst trainees. That is kind of more of a sense that we're all in this together. And especially if we're all in kind of the same workroom, we can kind of bounce ideas off each other, really help provide kind of out the elbow support, especially for the junior residents. That's so important. And definitely an aspect of that I think was challenging. Even like happy hours, we would do a lot of those before COVID in person, and just as a way to relax, relieve stress, but also connect as not just coworkers and colleagues, but friends. And really, I think those friendships then lead themselves to being able to support each other better at work as well. And so I'd say that's one of the challenges, has been kind of finding ways to still connect in different ways than in person, or kind of doing virtual happy hours, so it's not quite the same. Then I'd say the other element of this, and I've really seen this firsthand in terms of taking care of my patients. So one of the first things that happened was visitors were no longer kind of allowed to accompany patients, and many of our cancer patients are elderly, or kind of have deficits, and they often really rely on those family members, not just for physical support, but also to take notes or to kind of help them keep track of appointment details. And so, even if we teleconference those family members in, it's not quite the same support as they would have by having their family member there in the room. Especially for emotional times, or if the patient's bringing up very difficult things, even if we can offer a tissue or kind of give some space for emotion, it's not quite the same as just, holding the hand of their family member, something like that. And then I'd say the other aspect, kind of just a brief kind of personal story I have, is that a difficult experience I had recently was I helped a patient get through a very difficult treatment, 7 weeks of daily radiation treatments, and talked to that patient or his family member, pretty much every day of those treatments. He was having a lot of symptoms. And then it was so unfortunate that I saw about a month later that he'd actually passed away from COVID, and complications of COVID. And just to have, I think put all that, because I think especially kind of this idea of like defining your worth and your purpose from the outcomes of patients, that was really a, kind of a crushing moment for me. I think that I was like, wow, we got him through all of this treatment, and then, for COVID to, it's kind of this existential anger at, COVID,
Yeah.
Why did that happen? But I think on the positive side, I guess, getting back to kind of silver linings was, that I had actually thought to, call that patient's wife and offer my condolences, and to see if she'd be interested in like a bereavement counseling, because I knew we offered that service, and I was actually the first person to reach out to her to offer that. And so I felt that, even though it wasn't as much closure as I would have liked, at least I was able to offer something. And I think that's what can kind of help lead us forward in those moments of still being able to offer ourselves, to support, to provide, even though we can't, of course, give her husband back, at least, give what we can.
Yeah. So, obviously, as we're talking about burnout, thanks for sharing that was a crushing time, and that's okay. I think that sometimes the loss of our patients is crushing and can feel crushing, and it's emotionally challenging. So thanks for sharing that. I think that you had mentioned a couple of things about the silver linings of COVID, and I think one of them is really this emerging understanding of the importance of addressing well-being. COVID has been kind of a shockwave that's gone through our medical system, and we've seen providers really wrestle with the ongoing suffering, and so bringing this to the fore is really important. I have really benefited. So I have a young family at home, and so I've benefited quite a lot from the ability to work my non-clinic days at home. And I really hope that continues to be something that comes out of this. So the televisit, working from home, and I'm hopeful that we continue to see well-being as a central aspect of caring for patients well and delivering really high quality care. So obviously burnout is a very serious issue. And, kind of as I just mentioned, we don't often talk about how challenging it can be to walk with patients through suffering. What kind of strategies do you think work well in supporting wellness and preventing or mitigating burnout?
I think there's kind of a number of ways to think of this. I think that often kind of, personally in efforts I've led or kind of what I've seen, there's almost this stigma in general, about mental health issues, but in particular about, wellness. I think you had mentioned, resilience earlier, that I think sometimes this, especially in medicine and I think in other industries as well, there's almost a stigma against kind of wellness efforts because we think about it as like putting the onus on the individual to build resilience and to add one more thing to their plate or do one more wellness module. And, I think actually one of the drivers of burnout is that we're already, our plate's already overflowing with responsibilities, and actually offloading some of those might, I think is in general a more successful strategy than adding things to it. But I think that it's challenging to do that, right? We can't necessarily take away, the important work that we're doing in oncology. And as we were talking about, we're walking with patients on this journey. We're kind of absorbing their traumas. We can't really take that away necessarily. I mean, that's essential to what we do. But I think one of the ways that we can address it, and what I've found to be successful in my own efforts, here in my training program, is kind of thinking about, okay, I think there's, even though we kind of bin it all together, I think there's really a lot of different drivers, and kind of addressing each one individually is important. So, for example, thinking about, okay, what's on our plate that's overflowing, and is there, excess of those things? And I think that, COVID again has maybe, helped us think through that, okay, maybe we don't need to have, like in-person didactics that are stressing us out and help, making it difficult for us. And maybe, some of, because I think for a virtual, Zoom meeting, it's a little easier to log off or, put yourself on mute if you have like a child or a pet that needs something, or even, yeah, as you talked about, this flexibility of, working from home part of the days. Even getting to like doctor's appointments or dentist appointments, that's an issue that trainees certainly have as well. And so just being able to attend to your personal needs better, I think that's a way of, it's not necessarily taking something off your plate, but it's making something a little easier to do. On the other hand, I think that really successful wellness initiatives that I've seen really address burnout kind of from the grassroots rather than top down. And so I think, if it's just another one of these, online modules that we do that, I think a lot of us kind of click through quickly, just because there's so much. I think that that's, not necessarily the most successful, but if it's really kind of maybe a group discussion or kind of thinking about, okay, maybe especially in oncology, one of our issues is that we don't have a good outlet and we don't really have a good like safe space to talk about, death, illness, tragedy, all of these big, heavy themes that we're dealing with daily. And so, actually, one of the things I've been able to implement at my institution that's been very successful is adapting this national platform called Schwartz Rounds to the radiation oncology setting. And the idea of this is to give a safe space for talking about kind of the emotional, socio-dynamic kind of, truly community and also complexities, of care, that it's not just, the patient in front of us and their oncologic outcome, but also, the difficult family dynamics that sometimes arise, in patient support, as well as ethical dilemmas that can arise. And so what I've started at my institution is something called Radiation Oncology Reflection Rounds. And that really has given us a safe space. And we did do a virtual version of that as well recently, which went well. But this idea is we kind of all sit around and kind of think about, the emotional and, interesting impacts that dealing with cancer patients has, and also the ways in which we do have an outlet to talk about this. And so these sessions have often involved, even leaders in our department bringing forth their emotions in a way that I think is really impactful and kind of sets an example that, kind of this idea of it's okay to not be okay. And we don't often talk about that enough. But that has been very meaningful. And I think you hopefully will continue on after I leave here. And I think the National Schwartz Rounds platform as well really accomplishes that in a multidisciplinary way.
Yeah, I think a few things that are really profound is providing the opportunity to share emotions and have a safe space. I think too often we don't have safe spaces in medicine to say we're not doing okay. The buy-in that you got from upper level leadership and the mentors, those that establish the culture, is really important. I really believe that as we build a sense of community, a shared sense of purpose within our institutions, within our organizations, within the broader community of oncology, that can be a powerful mitigator against burnout, as we feel like we are in it together, that we feel like we are contributing to the greater good. That's so important. I've been privileged to develop an Art of Oncology program at my institution with others in psychiatry and palliative care. And it's a similar idea to allow for fellowship program to provide place to share our stories, to reflect on some of the more challenging issues in oncology, to reflect on suffering, to reflect on communication, to go into those places that it's really hard for us to talk about. And one of the things that we've really seen come out of that is this shared sense of meaning, this deeper connection, this understanding like, oh, you're walking through that too. And it's okay to share that this is really hard and I don't have all the answers. And oh man, I don't know what to do for this patient. And I'm feeling inadequate in my role as an oncologist or as in my role as a fellow. And it seems like everybody else is doing fine and I'm not. And having the opportunity to build those connections with co-fellows and others kind of in one's own institution is really important. I think, for me, as I went through fellowship, there were certainly this sense that I needed to let go of things that we can't control. And really saying it's unsustainable for us to think that we can save every patient, and really saying my goal as an oncologist is to, yes, deliver high quality care, but it's really important for me to care for each and every patient, to get to know them, to get to know what's most important to them, and to let go of the burden on their outcomes. I can't pick and choose which patients the chemotherapy is going to work. I can't pick and choose who's going to have the best outcomes, but I can serve and care for each patient. And by doing so and having kind of the opportunity to walk with that for patients, I can get a deep sense of purpose and meaning in the lives, really, of each patient.
I think that brings up a few really, important points, and I think one of those, and it really resonates with me, what you said about, letting go of what you can't control, and I think that goes for not only patient outcomes, but also just everything that comes with the work we do in medicine. It's often very busy. There's often many, workflow issues that are beyond our control, or, the patient showed up late, or then they're not roomed in time, or, just all of these workflow things. And I'm sure on the inpatient side, as well as I saw in my intern year, certain labs taking longer than, they should to come back, or, various things that there's just truly a lot in our profession, I think, that's outside of our control. And so I'd say that, I agree that one of the ways that I've been able to really cope with kind of these issues of burnout, the best has been, and I think a successful strategy in general for these issues and challenges in life is being able to kind of walk back from that and say, okay, kind of set a boundary, like a mental boundary of, okay, what's in my control, and what's not. And I think, some of these, inspiring quotes that have really resonated with me are these ideas of saying, okay, what are the things I can control? I can control that I show up on time. I'm compassionate for my patients. I'm taking care of myself, right? Sleeping, eating, kind of the bare bones essentials. And I'm going to be a supportive colleague for my co-residents. I'm going to help them out when I can. But you know what? At the same time, I'm human, and I'm going to inevitably make some mistakes, but I can't dwell on those or beat myself up about those, because you know what? I need to be able to bring my whole self to the next patient. And I think that's really been a healthy approach for me. And I've been able to, really overcome, a lot of barriers that way, being able to say, okay, all of these extra things, that are going on, whether it's the patient's outcome or the workflow, concerns. And I think humor too can be helpful, even if it's cynical humor, kind of saying, well, of course, on a Friday, I'll get, three urgent patients that I need to essentially stay overnight to treat. That happened on my last call week. But, the good thing was that the supervisor who was on call with me and myself, we just kind of approached it, with a smile and, yep, okay, this is Murphy's Law. It's going to happen this way. And I think that can truly help, kind of, these kind of, again, existential things. Well, I can't control this, but of course that's going to happen this way. And so I'm curious as to, for you, Dr. Richardson, kind of what other strategies you've had and kind of personally, coping with burnout and some of these issues as well.
So I think that, you mentioned about coming at your patients as a whole person. And I think that that's really important. I am a huge proponent of thinking as a community of how we can find meaning and purpose in our work. But as I mentioned before, this work can't be all that we have. So I think it's critically important for us to establish patterns in our lives of rest, of quiet, of rejuvenation, in order for us to come as whole people back to our patients and back to our colleagues and coworkers. For me, my Christian faith and my family are tremendous sources of strength and encouragement. And I really think that, it's important that as a community, we recognize that as whole people, as we come to our patients, we need to encourage the others to find those places of strength and encouragement outside of medicine, even if that means, yes, we need to encourage vacations, even if that means we take call for other people so that they can, establish better patterns of rest, et cetera.
Great. Yeah, no, I would echo that as well. That, really I think, and I think too, kind of this idea of redefining what success means as well. And I think, whether it's medical oncology, radiation oncology, surgical oncology, really all of us are very high achievers, and we're used to not only being able to some degree, control the outcomes of our own successes based on the effort we put in. I think one of the true challenges of, a field like oncology is that regardless of, how much effort we're putting in, how many extra hours we're putting in, that sometimes just the biology is very challenging. Some cancers, and by now, at the end of my training here, I've kind of learned which ones that, okay, if the pathology comes back as that, okay, I'm going to have to really reframe my discussion with the patient, and again, this idea of not giving them false hope, but at the same time, I think really there's a lot of tools from like palliative care and kind of this idea of, okay, this is a difficult situation, but we're going to, fight it with everything we can. And this idea of, even if we can't cure your cancer, we're going to be able to, support you, help you feel as well as you can for as long as you can. And so I think that, having kind of more tools in the toolbox, I think that rather than kind of this naive thinking of, the only good outcome for a patient is cure, really, I think, and especially in palliative care rotations I've done, it sounds like you've had a lot of experience in that as well. This idea of like a good death, or kind of this idea of, patients really kind of meeting their goals and, what they value. And I think really digging into that, it can not only help us really give our best efforts for the patients, but also their family members, and also just, kind of, again, reframe this idea of, what's a good outcome. And in some cases, the patient will succumb to their disease, but if we can offer them, peace, better time with family, reconciliation of difficult family dynamics, or just, reduced nausea, reduced headaches, reduced fatigue, I think all of that can be considered a success.
Yeah, I think it's a great point to say that we cannot define our success by the clinical outcomes of our patients. I personally define success, and I encourage kind of residents and others that work with me of saying, let's care for each patient. Let's deliver quality care to our patients and care for them. So that is all the time we have for today. I want to thank Dr. Laucis. This has been really great. I think, as we begin to allow COVID to bring up wellness and well-being into the forefront of our minds, I think we have a tremendous opportunity to engage each other on furthering this conversation for how we can better mitigate this in our community and develop a deeper sense of community and purpose as an oncology community. So it's been a wonderful conversation. Thanks for listening to this episode of the ASCO Education Podcast.
Thank you for listening to this week's episode of the ASCO eLearning Weekly Podcasts. To make us part of your weekly routine, click subscribe. Let us know what you think by leaving a review. For more information, visit the Comprehensive eLearning Center at elearning.asco.org.